I want to invite our coroner, Rich Jorgensen, Dr. Rich Jorgensen, if you'd be kind enough to join us up here at the podium. This morning we're joined by Coroner Rich Jorgensen, who will provide us with an update on the heroin epidemic that is happening right here in DuPage. Rich, all of us share your concern, our deep emotional alarm about this use of heroin in our community, especially by teenagers. There's just another article written in the Sunday Tribune. It's been on the national news, and we're all determined to do whatever we can to stop this epidemic, and I think you're here to offer us a little direction. So, Rich Jorgensen.
Thank you, and I'm sorry I've got a little scratchy throat, but from the highs to the lows, from the great Chicago Symphony Orchestra to the great difficulty that we're having with heroin. And I put this picture up here to start to enhance and make us realize that this is really a bad, dirty disease that is in our community and devastating our community. And it is nothing is pretty about it, nothing is nice about it, and there's nothing romantic about it. It is this picture. Eventually, all people that are involved in serious drugs and especially heroin devolve into a very, very serious spiral that ends up either in rehabilitation if they're lucky, in our criminal justice system if they're also lucky, or dead. There we go. Now it all starts with a very beautiful flower. And the flower is not much different than the poppies that we have here in America. The poppies that we have in America don't make opium. But this is the beautiful flower, and to use a very telling example is that if anybody is a gardener and knows about the poppy plant, it grows, and for about a day and a half it has a beautiful flower, and then the wind blows and the flower is gone. And that's the same thing with heroin addiction. It's very addicting. It's very, very difficult. And if there are any highs and anything good about it, it is gone very quickly. The flower quickly turns into this kind of a pod, and that pod is then manually harvested. It's a very labor-intensive process. The harvesters score the pod. This little drip of sap comes off of there, and that sap is the most potent natural source of morphine and opiates in the natural world. The harvesters then come along and scrape off that sap, and that's further processed. And in the old days, it was processed into this product, which is called black tar. And this is what, back when most of us were kids, was on the street. And this is why it was injectable, and this is why it was really dirty and bad, because it was not pure enough to be smoked very, very well and that type of thing. So it was injected for the most part. And that was part of the reason why it was in most of our minds considered to be a very dirty, a very dangerous thing, because you had to stick a needle in your arm, and most normal humans don't like to stick a needle in their arm. The problem that has occurred today, and the reason why this drug is blossoming and killing more and more people, is our processors of these chemicals are much smarter and much more able to refine the heroin to be a very, very pure white powder. And so this now, instead of being injected, can be done in many other ways, including ingestion and smoking and that type of thing. So the kids today, or the people today, say, you know, this isn't that bad. The thing is like smoking a joint. And so the heroin today is much purer and it's much cheaper. You can get a $10 bag of heroin and initially get high for very, very cheap. It eventually gets to be very expensive. This all came from a wonderful hope, and that is it came from the medical community. Morphine, heroin, cocaine, all these drugs came from the medical community trying to identify medicines that are beneficial to society. Morphine continues to be very beneficial to society. As a doctor, I used it every day post-operatively. It's very important for pain relief. We wouldn't be able to do the operations that we do without proper pain relief. However, those things are very addicting and have been usurped into the illegal drug society. Here's an ad from Bayer aspirin, or from Bayer years ago. At the top, you get your aspirin. Right down there on the left side, get your heroin for the suppression of coughs. Isn't that? And so it was considered to be a very non-addictive, positive medicine. It proved to be a very addictive and very dangerous medicine. I think we all know the short-term effect. Heroin is a euphoric. It makes us feel good. It makes us feel happy. It makes us feel content. It is not, there are other illicit drugs, some of the PCPs or cocaine and other things. They're stimulants. They do a totally different thing. But morphine and the morphine type drugs are very different in that we have natural receptors in our brain because we need to feel happy and content in those things. We actually have chemicals in our body that are created that mimic the morphine effects. The long-term effects of morphine or of heroin are just simply addiction, addiction, addiction. It is not a drug that you casually use. You may get away with using it a couple of times to get away not being a heroin addict, but every heroin addict that you talk to will tell you that the first high was the greatest, and then they spend the rest of their life trying to chase that one great high, and then eventually it devolves into being all they're doing is taking the drugs to keep from being sick. And every heroin addict will tell you the same story. It's addiction, 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 and all of the effects are destructive to the body, the psyche, and the person. And why is that? This is a chart. I stole it from the internet, so it's got to be true. But you can see the yellow ones on the bottom. I don't know if you can see them, but they're, ecstasy and various drugs that are down in the yellows. And then you get up into some of the other drugs, tobacco, alcohol, benzodiazepines, and amphetamines. And those are moderately addicting. And then way up in the corner there, and you can see on the bottom, it's physical harm versus dependence. And way up in the corner off the charts is heroin. And it is the most addictive. It is the most destructive drug that is in the pantheon of illegal drugs. So I'd like to get to some of the demographics of our county, and I went back and looked at all the deaths in 2012 to try to see what we could do, and I further updated that with 2013. 2012, we had 38 deaths purely related to heroin. And today I'm only talking about heroin. There's a whole nother pile of people that have died from cocaine overdoses and other overdoses, but we're only talking about heroin today. You can see there's males are 30, females are 8, so it's a predominantly male disease. Age range, this astounded me, was from 19 to 56. As a doctor, I never saw a 50-year-old heroin addict. And I can, if we have a little time, I'll tell you one of the reasons why that's occurring. But last year we had a 19-year-old, and that went all the way up to 56. The age range, we had one 19-year-old. You can see there's a big bump in the deaths between 20s and 30s. And quite honestly, you don't get as many past that because if you're addicted to heroin and you're involved in heroin, you don't live into your 40s and 50s. But we have a new phenomenon that's creating addicts later in life. This is where they lived in 2012. And this, I'm just going to tell you right off the bat, this is not to pick on any town because I'm going to tell you that there's no relationship to any town. But these are the towns where the deaths occurred in 2012. I put this slide up. There are 4 people out of those 38 that lived in one town and died in another town. And the only purpose for putting that slide up is people live where they take their drugs in DuPage County, and they take their drugs where they live, and they die where they live. There are other counties, like Lake County and other counties, where there are places where people go to get their drugs, and they die in those places because they're leaving a nicer community to go to place. And so we don't have a lot of that. Most of the people die in their own homes or near their own homes taking the drugs that they get. And this is why I'm here today, beside the fact that we have a horrible heroin problem. You can see that in July, we went from having, this year in 2013, we went from having the lowest of 3 in a month to 5 in a month to 4 in a month. So we're having about a death a week in DuPage County due to heroin alone, only heroin. In July, we had a body coming into the morgue every day, and we had 18 total deaths from drugs in July. 7 of them were from cocaine and from other things, and there were 11 deaths in DuPage County from heroin. So far in August, we've had 4, and then the newer numbers, we haven't finished our cases and closed them out, so I didn't want to give you incomplete results. What are the demographics from 2013? Similar. It's mainly, so we have as many deaths in 2013 as we had in all of 2012, and we've got 4 months left in the year. The males, again, predominant over females. Age range is extending. Look at this. From 15, we had 3 teenagers this year so far, and we've had 2 people in their 60s. The teenagers include a 15-year-old from Bartlett that the police chief and our state's attorney and such investigated it and found 14, 15, and 16-year-old kids that were involved with heroin. There we go. This is the cities that they lived. Again, the numbers are the numbers directly related to the town are the deaths this year. The ones in parentheses were the deaths last year. My only point in putting this up is I'm not picking on any town, and there is no town to pick on. You'll see that the numbers changed, and all the ones in red over there were towns that had deaths last year that have not had a death this year. So my point in this is that there is not a hot spot. There is not one town. It is a countywide phenomenon, and we examined the drugs that we do sophisticated toxicology on every one of these deaths, and these are the drugs that we find in there, and these are the typical drugs from heroin. 6-MAM is a degradation product of heroin, morphine, and codeine. Just as an interest, these are the other drugs that were found in the people that died of heroin overdose in 2012. Antidepressants, 11 out of the 38. A lot of these people are being treated for depression. Mental health and addiction go hand in hand. We I think all know that. I'm not sure that we all accept it and understand it. Amphetamines. Amphetamines are opposite of heroin, so you don't see a lot of people using amphetamines and heroin. Cannabinoids, a lot of people are smoking dope, but at the same time, a lot of people use that as their delivery method. Last thing here is alcohol. There are 11 out of the 38 people that had alcohol in their system. 7 of them were fairly seriously intoxicated. And the summary of that is that we did not find one person that only had a single drug in their system. They were taking multiple drugs of all different kinds. So what are we, oh gosh, thank you. See, you give a guy a clicker. So what are we doing as county officials and people involved in this? Number one thing is that we have to raise awareness to the public and the press. And I think that some of the departments don't have an ability to do that. Mine does. State's attorney, the Department of Education, Darlene Rossetti, and various. We are all very actively involved in trying to get this message out to the community. The article that was in the Tribune this weekend, though they gave me a criticism about it, I actually did try to help them as much as possible in doing that. So we all need to raise public awareness. We, second of all, address school education issues. One of the things I'm going to ask you guys to do is use your bully pulpit. These schools are reluctant to agree and believe and teach that we have a heroin problem in DuPage County. When I heard this, I asked Darlene Rossetti to set up a meeting with her superintendents and principals. One of the principal that I know personally for many, many years told me, this is fine, we all got it under control, we're working on it, that's great. You know, and by the end of the meeting and hearing these type of things, she came up to me and said, we need to talk, we do have a problem, I understand that. Please talk to your principals, your superintendents, and make them accept and teach and understand that we have a serious heroin problem. They do not want to be the first one to say, oh, my school is, and we're not going to have a meeting about that because we don't want to admit we have a problem. Believe it or not, that's something that we're fighting. The last thing I'd just like to talk about that's going to be started here in DuPage County will probably be the first in Illinois to do this, is what we're calling the Narcan project. It is it is a law that was passed, and it's in the Drug Overdose Prevention Program, and it says that the director of this program may establish or authorize programs for prescribing, dispensing, or distributing naloxone. Naloxone is the pure antidote for heroin. If someone is in a heroin overdose and you give them naloxone, they will literally wake up and come out of their overdose. As these deaths were occurring, the chief of police organization came to me and to Bob Berlin and said, what can we do about this? We've heard about this Narcan project. So within a month and a half, we have got the Board of Health, ourselves, the chief of police. We're trying to get the fire departments involved, and within another month or month and a half, the police departments in DuPage County will be carrying Narcan in their cars as they're the first responders to many of these scenes. Further about this program is that it then allows people to call 911 and create, for us to create overdose training and recognition. Then most importantly, and this is where I'm going to ask you guys to understand this program, is that we will be prescribing and distributing naloxone. Now, Chairman Cronin could probably tell you about that. This was a very contentious issue in the General Assembly when it was discussed, because we will, in this program, be giving out naloxone, the antidote to heroin, to police officers, fire officers, and families and friends and the public who have heroin addicts in their community or in their home. And if somebody is dying of an overdose, the first responder is the mother who finds her child there. This is very innovative and has some questions to it, but we are going to develop a program where we train these people how to do this properly. And again, in this law, it properly excludes if I and Dr. Chug from the health department are going to be the prescribing physicians on this. It protects us from writing these prescriptions and giving this one drug to people that have heroin problems and allowing them to give this drug. And then lastly, if a person is involved in any drug activity or around a person who has a drug overdose, that person can call the police and or give this drug. So a regular non-medical person can give Narcan to a person who's having an overdose and not be prosecuted as under the Medical Practice Act, like you're acting like you're a physician. This is very important. This is probably the first time this has been done. The only sad thing I kind of sad about this law was enacted in 2010, and not really much has been done with it. I think it can be a very valuable law. And in DuPage County, we are going to have this in full force in about a month. Yes. Well, that's the problem, and that's where our our great elected official, Bob Berlin. We asked for his help on this and his evaluation. The only thing that the General Assembly left out that is in other laws and in other states where they specifically say you are protected from civil liability. So in the next session, Bob's already helped to rewrite the law, and we're gonna present an amendment to this law in the next General Assembly. So, what can the county board do? The county board can be aware that this is a real problem, and the message I want to bring you is that it's in all ages, it's in all municipalities, and it's in all socioeconomic groups. It's not the rich kids down there, it's not the poor kids up there, it's not the little kids. There's, as I showed you, there are 2 people or 3 in their 60s. So it's not our typical thing in this county. It's a very wide-ranging problem. The second thing is to be understanding. This is a disease. All addictions are a disease. And if you've ever met somebody at the dregs, I think probably we all have somebody in our family like this, but I do, that in the dregs of addiction or the dregs of alcohol or heroin or something, you know how horrible it can be. You know how destructive it can be. And then if you've met somebody who's in recovery, you understand that those people can go back to being productive citizens and have a life back again. These are not people that should be put into the detention system and lost for 10 years. Be progressive. Many of the programs and answers that have been done and are involved are outside of the square box. And one of them that you already fund is a drug court. You know that in a drug court you take people who are involved in the criminal courts, and through recovery, through a strict program of recovery, you turn those people back into productive citizens and diminish their criminal counts. That's outside the box, but it's working very well. This Narcan program is outside of the box, and it was when the General Assembly passed it. But it is a program that has been proven across the country to save lives. And the last thing is be a funder. You knew I had to ask. We need money to run these programs, and we need your support in developing all kinds of new programs. And the last thing I'd ask you to do is use your bully pulpit. This is a story that has to be told. The more we ignore this, the more we hide from it, the more we say it's not in our community, the more we're going to have people die. So that's my presentation. I'll address any questions. Thank you. Jim?
Yeah, first off, can we have this in a format that we can run it as a piece of paper, so when we're giving speeches to the
yes.
Rotary or to the Kiwanis or to the Lions, we can use
Sure.
this as our speech.
I actually have, to save you all from falling totally asleep, I actually have about 20 more slides that I hid. That's a much more complicated thing. I'll give you the whole presentation and send it to anybody you want to, because if we save a life with this, that's most important. Thanks.
Also, was there any reasoning for why July was the worst month this year?
No, there is no reasoning ever with drugs, but most people die of 2 things. You either have bad drugs or tainted drugs, or you have good drugs. And in talking to people in the drug community, which I now talk to every day, it seems like I don't mean the users, I mean the prevention people. The general consensus is that the drugs were too good, and they were very hot. They were very, very strong. They weren't cut as much as the usual drugs are, and that's probably the #1 reason. Yeah.
What happened to meth as the #1 drug? For a long time, methamphetamine was the #1 drug. In fact, there were the meth warehouses and the meth labs and all that.
Right.
I don't hear any much on that anymore.
No, we don't. Meth is very, very big drug in rural communities. It's not as big up here in more dense communities. The reason, if anybody's seen Breaking Bad, you got to be in a mobile home out in the desert somewhere to make meth. You can't. It's very smelly. It's very, very it's difficult to make, and it's more of a rural drug. And DuPage County has not had as big a meth problem as other areas.
Finally, with what Mr. Berlin's going forward on with civil liability, because I put that too, any chance that can be brought forward in the veto session? Wouldn't that make a little bit more sense for us especially if we're going forward with this program now to avoid any Murphy's
Right.
Law kicking into effect.
Right.
So I would encourage the chairman to work with Mr. Berlin to maybe do that in the veto session.
Okay. I welcome that. I don't know how you guys do this. You want to just jump up, or it sounds a proper order and fairness. All right, we'll start up here with Pete. Go ahead.
Thanks, Doctor, and this is very informative. I know back when I was a mayor, I was very concerned about my school district. I actually engaged with Robert Crown, who's probably one of the most formidable educators on this issue of public health and drugs. And the fight I had is I think denial. A lot of these school districts just say, oh, we can't fit this into our program. We've got it under control. But I saw 2 of those deaths were from my community. And I saw 6 were from Lombard, which is my district. So I will use my bully pulpit for sure and do whatever I can to help you. But I think we need to have some private partners like Robert Crown involved with this. They've got evidence-based teachings. They'll start them in as early as middle school to nip this, because I think it's all in education. And once
Right.
these kids are addicted, from what I understand, the addiction rate is just off the first time is like 60%. So
Right.
we need to nip this as early as possible. And I
Right.
think Robert Crown hopefully is one of the solutions to that.
Yeah, thank you. Why don't we just go through the, yes.
Thank you.
Yes.
I had a couple questions. The older population you mentioned.
Yeah.
You said
Yeah.
you were going to explain what you thought was.
Yeah, I didn't want to go endlessly on this, but if you're going to ask me the question. So we have another problem that we as leaders are trying to address in the medical community is that we have a significant number of people of all ages that are becoming addicted to heroin through us, through doctors. We prescribe opiates way too easily and in way too large a supply. Chief Williams from Bartlett was telling me that his nephew had a sprained ankle, and he comes home with a prescription for 60 Vicodin. 60 Vicodin is, you could get through 3 operations on 60 Vicodin. This is a kid with a sprained ankle. That's creating an addict. And so what's happened is we're finding, in fact, I met a young man the other night, 29 years old. He became addicted because he was a hockey player, and he injured his shoulder a couple of times, and through OxyContins and Vicodin, he then kind of like, hey, this is pretty good. Well, then after a while, you get addicted to those medicines. Those are really expensive on the street. When you try to get Vicodin or OxyContin on the street, it's much cheaper to go get a $10 bag of heroin. It's the same high. So we introduced them to the opiates, the medical community. So Dr. Chug and I and other people are addressing this at the Medical Society in a program that we got to talk to the dentists, the oral surgeons, and the doctors to wake up about this prescribing habit. The other thing is, we had a program the other night where we were talking to the kids, and it said, to tell the kids, don't take these medicines. When some doctor gives you 60 Vicodin, either your mother or you or your father say, I don't want those pills. Go give me something that's easier. So we're having an introductory system of people through prescription medications that then they get addicted to it. They can't get the prescription medications, and it's cheaper and easier to go to heroin. Isn't that crazy?
Yeah,
I mean, that's,
it is.
yeah.
And then I also had a question along Mr. DeCiani's question with the younger kids. We've seen in our schools in Downers Grove, DARE cut out of the programs, and Downers
Right.
Grove is one of the highest on the list.
Yeah.
So is there, and I know my kids loved when the police officers came and when they were at school, they really listened to them.
Right.
I mean, they really took what they said seriously. So any chance of working with our police officers, getting them back into the schools or
Well,
doing seminars?
this whole Narcan project that we're talking about is being asked for and run by the Chief of Police group. So the chiefs are really on the front lines of this. And again, it's a little bit of funding and it's a little bit of ostrich, because I can tell you that that I've talked to a number. We tried to do a heroin program at a high school. The high school told us we could use their auditorium, but do not put our name on any of your literature, and don't use our name when you talk about this, because we don't want to be associated with heroin. So that's when I went to Dr. Rossetti and said, call all of your principals and people together. If any high school or middle school here doesn't think that we have a problem in your school or that you have a potential problem, then you're just oblivious in this county, because every one of them do. We need, if you know a principal or a superintendent or a teacher in that has the influence, tell them, we need this in your schools, and we need to be honest and develop programs. And there's a lot of different models. This is one model. There's a bunch of different models to try and do this. But we have to get that back in our schools in a way that's really intelligent.
And then
Yep.
the last question would be your funding. Where would we donate? Do you have a?
Well, for example, like this Narcan project, the original funding, the Board of Health has given us a little stipend, and we need funding with that to keep the drug courts going, to those kind of things, the innovative programs that help drug addiction. Those are this. Right. Well, I'm talking. You guys are the keys to the castle here. You know, these are programs the ones that I'm hoping for is that we're going to develop through the proper governmental approach. You know, these are not private programs. These are government programs that we should be doing. So, thank you, Gary.
Rich,
Yeah.
thank you for doing this. Also, glad to hear the Board of Health is involved too. Just for everybody's further edification, tonight at Elmhurst College, in fact, at the Frick Center at 7 o'clock, I believe there's a program tonight which State's Attorney Berlin is one of the keynote speakers.
Yeah.
It's good to see that the message is getting around. So tonight, 7 o'clock at Elmhurst.
Thanks.
You. I know.
I'll join everybody else in thanking you for giving us this presentation, Rich. Just sort of dovetailing off of what Member Chaplin said, I remember when I was in high school last week that the DARE program was a pivotal and integral part of education at all three levels: elementary,
Right.
middle, high school, I think it's instrumental in our prevention efforts in DuPage County. I think as a county board, we should be looking at exhorting our school districts that have cut the DARE program to maybe reinstating it. But what I wanted to ask you about was, certainly we can pursue all available prevention methods through public school system. But the bulk of the cases, and especially the deaths, were ages 20 to 40.
Right.
And that got me thinking, we can institute prevention programs in our universities and our college campuses, COD, Benedictine, North Central, but how many of these cases are outside of that system? Are people who are dropouts or have...
Yeah, but the key thing about the education piece is, as you said, when I was in school, I still to this day have a terror of heroin and a terror of a true understanding that this is a drug that you don't want to try. I know I can have a glass of wine and I'm not going to become an alcoholic. It is a different type of drug, and we're taught differently about it. Heroin isn't like that. You don't be an occasional heroin user. So if we teach in our middle schools and our high schools that the true knowledge of this drug and what it does, that affects the 30 and 40-year-olds too. So I understand what you're saying, that a lot of these people, what do we do now? We certainly need, the DARE program is a whole thing that I don't agree with it as well. The people in the DARE, people will tell you the DARE program did nothing to affect drug addiction or alcohol addiction, and I totally disagree with that. And you're speaking up for that. But there are people in the addiction community that said that it's a waste of money, it didn't help anybody. Well, where would we be if we didn't have the DARE program? How many addicts or drug addicts or alcoholics would we have if we didn't have the DARE program? But anyway, that's something that's outside, I think, our ability to discuss here, but it's at a higher level. So thanks. Yeah.
So just an idea I wanted to float to everybody here is if there's any place that we can't reach out to folks who might fall into a pattern of addiction, the one thing that everybody needs is money, and the one place that everybody would go to get money is getting a job. And if there is any way that we could create some sort of equivalent program to DARE that we could partner with employers, perhaps, and try and encourage employees who might have histories of addiction, to continue,
Yeah.
reinforcing, prevention in everyday life. That's something I would
Yeah.
be interested in.
Thanks. Anybody? Oh, Sam?
Thanks, Rich. Those of us who are somewhat aware of this think that everybody's aware of it. I know that about, maybe it was a year ago or so, at Lake Park High School, you and Bob Berlin and a number of chiefs put on a really great presentation. It was significantly longer in time and even much more informative. The disappointing thing to me that night was that there were more presenters and elected officials than there were parents and kids in that auditorium. So I don't know that the school districts maybe are the people. They're important people to get to, but it's the parents who also need to be informed of this because they're as much in denial as the school districts. The other side of that is I don't do it as a specialty, but in the last year, I've had 6 cases that I've represented young people who were charged with heroin, possession of heroin, all from good families, all from DuPage County, and all went down the heroin highway and get off at Madison Street and picked up their heroin and came back. All of them were recidivists, and the reason they was primarily because they couldn't get a job. And that was the major problem for them. They would go make a job application. On there would be a question, have you ever been convicted of a felony or whatever? They said yes, and they were done. McDonald's wasn't going to hire them or anyone else, and consequently they had more time on their hands in order to do what they did, which was to continue to use heroin. Now, in addition to what Tony said, I think employees would be great to somehow get into this program, but employers as well, because without people who are willing to give these kids jobs, I've got a couple kids in a halfway house right now who need to get a job in 14 days, otherwise they're going to get kicked out.
Right.
You can't get a job in 14 days if you're not a convicted felon, let alone if you're on probation for heroin. So the problem is that it's a continuum of getting arrested, getting put on probation, being told to get a job. You can't get a job. You go back out on the street, and the cycle starts over again. I don't know where that fits in here, but really that's a very important component, I think, to this that people need to be aware of. Our employers especially, our business community, maybe through whatever agencies that work with us in terms of
and compounded with that is we're coming out of a horrible economy. There aren't jobs for the people that aren't felons. I mean, so it's obviously difficult. Chairman, you tell me when we're done with this, okay? So, Amy.
This would be quickly just to add on what Sam was talking about. Disappointed that there weren't more parents in the room. There were more elected officials and more presenters. And I'm just thinking for our bully pulpit, we can easily go out to PTA meetings in our community and just ask to present to the PTA meetings.
Well, the good news that I can tell you is in the 10 months or so that I've been in office, that first meeting, again, was devastatingly disappointing to me. I came from a meeting 2 nights ago in Bartlett, which was the second meeting. The first meeting had 400 people at it. The meeting the other night had 300 people at it. So, and part of it is also, I said, we talked to Darlene Rossetti and said, you have to tell these principals that this is a critical part of our community, that we address this. I don't want to name names, but there are high schools, including the Lake Park High School, said, you can't use our name in this thing. Well, luckily, both of the principals of Lake Park were at our meeting with Darlene Rossetti, and they walked away saying, we understand now. We understand. So that's what I mean about using our bully pulpit and being honest about this. If we're not honest about this problem, we're going to just continue to get dead people in our morgue. So, Mr. Fickner, I'm just going down the row with questions. Any of you guys going back there? Grant?
I don't have a question. I just wanted to make a little bit of an announcement. Following up on, I appreciate the fact that you're here educating us, and it seems to me education regarding the heroin issue is key. So I, as part of JPS, have asked Public Defender Jeff York and our State's Attorney Bob Berlin to come to the meeting on October 15th to educate us regarding this issue from their perspective. And I know the entire county board is not part of JPS. There's only a few of you that aren't, but all of you are welcome to come to that meeting to get further educated on the issue.
Thank you. Good. Done? Good. Well, thank you very much for the opportunity to talk to you today. Thank you.
Thank you, Rich.